Okay, so we're here with Dr. Shilpy Bhadani. She's a very active and well-known plastic surgeon from India.
Thank you.
Thank you for coming. So she's been visiting actually for the past few days, and just tell us a little bit about that. How was your visit? Have you been for a few days? Seen some facelifts, some surgery?
So thank you, Dr. Bravo, for that introduction. And yes, I'm from India. I'm a plastic surgeon in Gurugram. It's a city near New Delhi. My first interaction with Dr. Bravo was in 2022.
That's right, yeah.
2023, I think, 2023, in a conference at Ambi Valley in India. And I was hugely inspired by your lecture, and that is when I decided to visit him. Yeah, I'm here in Madrid, and I'm loving every bit of my stay over here. I came about 3 days back. A lot of learnings, actually, and a lot of beauty around the city as well.
Yeah, nice.
So, like in your lecture, you said that we should be connoisseurs of beauty.
Right.
And that is, and I see where you take all your inspiration from. You live in such a beautiful city.
Good.
The city is very vibrant.
Right.
At this time of the year, not as cold as I would have thought it would be. But yeah, it's been very good watching surgeries with you. I watched 3 surgeries, and it's a great takeaway for me.
And we did some deep neck work, right? What's your take on that? Some of these procedures are long, there was a long.
I mean, when we talk about face and neck, I feel that sometimes things can get so overwhelming because there's so much to do.
Right.
And for me, it's been a big leap from doing lateral mastectomy, which I learned earlier.
Right.
And then going to deep plane by reading the texts available. But neck is where, I feel that we really make that difference between a great result and a good result.
Right, yeah.
I think, watching how you reduce necks, the glands, the digastrics, the fat, and overall, how it comes together beautifully. It was absolutely I would say an eye opener for me.
No, that's great. No, I think Shilpy, you're already an experienced aesthetic plastic surgeon. You trained right in Switzerland. You went to do a fellowship in Switzerland.
Yes. When I finished residency, I went to La Clinique Montreux, and that was through the Dutch Association Fellowship.
Nice, yeah.
So I spent some 3 months over there learning a lot about aesthetic surgeries. But it's been a great learning to start the aesthetic practice, and a lot of things have changed since then. But especially with the extensive work on the face and the neck now. But I would say that what we really think as a neck lift, difference between the reduction neck lift or the dual plane
technique
that you do. I feel it's very different.
Right. Yeah. No, and it's good that you're able to recognize that, and you're able to, in your stage with your experience, that you have such a big practice in India, that you recognize the need to sort of, go through these sort of more kind of sophisticated surgical procedures, but they're very, valuable in order to get these results.
Yeah, that's what I was telling you, that, having read the text and having watched a procedure, it's there's so many different nuances that you need to details. And it's, I don't know, as a beginner, if I would be watching you,
it's a bit overwhelming.
Definitely overwhelming, and I'm not sure if I would be able to imbibe so much.
Right. No, but I think I agree that, the degree of sophistication of some of the, areas of the specialty is advanced so much in the past years that you really need to go in depth with some of the surgeons that are doing these techniques in order to bring them into your practice, right?
Yeah, and I think, as plastic surgeons, we owe it to our patients that, when they're coming to us, they're really looking for the best.
Right, yeah.
And when we say the best, it has to be the best.
Exactly. So, that takes a big effort, but I think it's worth it. And actually also because you're also doing, Shilpy, all the procedures, right? In your practice, you have a very broad spectrum, right? And it takes a big effort in terms of...
It does. So I'm into breasts, bodies, We do rhinoplasties, face and neck, of course, otoplasties.
Yeah.
So yeah, it's a mix of a lot, but in India, it's mostly a mixed practice for a lot of people. And but I do have a team. I mean, I don't work alone, and that is how it is possible.
No, you have an incredible clinic. No, you have a great practice, and you're very established right there in the area of New Delhi, right?
So we do get patients from all across India, but I mean, after a certain while in one's practice, you do feel the need to go and watch more sophisticated procedure, how you can bring those little changes that make a lot of difference.
Right, it's a big difference. And congratulations for you to having that, making that effort, because you're an experienced plastic surgeon. You've been to a lot of meetings, you lecture. What are the differences that you see between the practice in India and what you've seen in Europe and other parts of the world?
Well, I think, when I was doing my fellowship then also and now as well, I feel that in Europe, the practice is more like, a particular surgeon would be known for a few surgeries more than the others. It's not a huge mix of practice in Europe. Like, I mean, even if when you take big names like, Enrico Robotti or, so, I mean, they are more concentrated on one specific
area.
And that is how I think they become the best.
That field.
In that field, and you push the boundaries all the time.
Right.
Especially like, I mean, you are so much into teaching, and I saw that, you enjoy teaching a lot.
Sharing.
So I feel, and more, if we talk about plastic surgery in general, in India, we have a lot of body contouring procedures.
Right.
We have a lot of them.
Okay.
And the face and the neck, of course, facelift and neck lift, it's begun to get very popular now, especially with people on camera and, all the time they're looking at them.
And the results have improved also, right? With these more modern techniques.
Yeah. And, we are always making it more safe.
Right.
For the patient. So I think that becomes a very important point. I always tell my patients that, when a particular procedure becomes the gold standard procedure in any particular specialty or a particular subspecialty, it has stood the test of time.
Yeah, definitely.
That is how it becomes the gold standard.
Right.
Otherwise, and I think reduction neck lift is going to be the gold standard.
Difference.
Absolutely.
Right, in terms of the results. So, Shilpy, where can we find more about your work? We can find you in social media and Instagram.
Instagram handle by the name of Dr. SB Aesthetics. That's my Instagram handle, and my personal handle is Plastic Surgeon SB.
Plastic surgeon SB.
And my YouTube is again SB Aesthetics.
SB Aesthetics. I know you're very active. You have an incredible channel, a lot of information. So that's a great place to learn about the specialty, learn about procedures.
Yeah, we do a lot of informational videos for patients where so they need to know about the procedure. I feel that there's so much of myth surrounding plastic surgery on the internet, and people don't know where to look for information.
Definitely.
So I feel that it's a part of the responsibility also that we dispense the right information to the patient.
Important,
because there's a lot of fear mongering. Regarding plastic surgery.
No, and also there's a lot of people that are sort of talking, and oftentimes the message is not the correct one. So to have a real plastic surgeon, a well-trained, that experience like you, being able to really talk about the truth about, the procedures, the safety, the recovery and everything. It's very important for the patients. Okay, Shilpy. So it's been great having you.
Thank you, Dr. Bravo. I can't thank you enough for having me, here, observe you. Cool. It's like I've come a full circle,
No, it's wonderful. I always appreciate having, visitors that have some great insights like you had in the specialty, even while we were doing the procedure. And that's always also helpful for me, because it makes you also think as someone that has to share techniques. So it's been great. It's been great having
you. I also run a fellowship program in India. It is for the fresh plastic surgeons who are young plastic surgeons who come to train with us for 3 months. And I think it's a great take-home message for me, and especially when we are teaching a particular when we are kind of mentoring the younger generation, it's a responsibility. I feel that as teachers, we also have to be ahead of
No, definitely.
so I think it's really very, very good for me that I came here.
No, it's been a pleasure. Dr. Shilpy Bhadani, follow her. She's one of the leading, big plastic surgeons there in India. So thank you so much.
Thank you so much.
Okay,
Thank you.
Thank you.